Now the AMA President, Dr. Brian Owler. Dr. Owler, thanks very much for joining us this morning. That reduction for the rebate on GP consultations, for shorter consultations, was due to kick in today. Your campaign worked very effectively against the government.
Well, that's because it was poor policy. I mean, it's easy to campaign when you've got such an easy target, and it angered GPs right across the country. But I think also the public understood that it was very poor policy. And I really think that what we need to do now is not only hit the reset button on the ministry, the faces that are delivering the message, but also not just on the policies but on the process. And I think we need to get back to talking about health policy, which is a very complex area, so that we can actually improve healthcare in this country.
Now, were you surprised by that report yesterday that Peter Dutton, the former health minister, didn't want the reduction in the rebate, that there was a leak, as you heard me discuss a bit earlier, that he didn't want the rebate reduced in the first place?
Well, I think it really doesn't matter who said what. I mean, there was the government were digging their heels in on the first co-payment proposal, and we had that discussion going on for a period of 7 months, and then we came up with a worse proposal. And I think at the end of the day, as I said, this is a problem of process. There was no consultation before the first announcement and none before the second. And I think what should have happened is that the government should have actually spent that time talking to people that actually work in the front line, the GPs in their practices, who were able to tell them what the problems are. And I think people have a lot of good ideas for health policy, not only just around general practice, but right across the health system, that we can get much better out of our health system and improve the outcomes for patients as well.
Now, you've said you don't want just a fresh face in the health portfolio, you want a fresh approach. How would you characterise the government's approach to this point under the former health minister and across the last 12 months?
Well, look, it's been a very surprising approach that these announcements, as Graham Richardson said, were really an ambush on the Australian public and on the medical community as well. I mean, we've had things floated in the media back at last Christmas, and then the Commission of Audit, and then all of a sudden a surprise announcement in the budget. And the extent of the co-payment was never really indicated up until that point in time. And of course, ultimatums were given whether to support the government or be on the outside, and at the end of the day we had to stand up for patients. And so we've had a breakdown in the relationship, but what I am pleased about now is that we do have a health minister who appears very much conciliatory, who wants to get on with the job of consultation. I think that's a process that should happen over the next few months, not just with organisations such as the AMA, but GPs on the ground, doctors in hospitals, so that she can get a good understanding of what the issues are and then work constructively with the AMA and other groups to come up with health policy that we actually need in this country desperately.
Dr. Owler, I'm almost out of time, but just very quickly, can a co-payment work? Because the government is sticking to that price signal. They say they are going to deliver one.
Well, I think that's only a very narrow view. I think there are many other things that we need to consider, like chronic disease management, prevention, and how we get the best out of our hospital system, and that's where we should be having a discussion about the whole of the health system, not just general practice.
Dr. Owler, thanks for your time. I appreciate it. Before you head into surgery, I think, in the next hour. Thanks for that.
Thank you.